This is Ingrid from Healing Arts. I know I'm a little bit early, so just wanted to say hello. Hi. Guess I'll try to wave back since I'm a little early. Okay. Hope everyone's doing great. Okay, so thank you for joining. I'm doing a Instagram live workshop on Candida. Today we're going to go over what Candida is, what are some symptoms of Candida, what we should do if you have Candida, and how do we get Candida, and the best part, which is my favorite part, is foods and ways to kill and get rid of Candida. So, okay, I just want to let you guys know I'm trying to do something new on Instagram Live, which is show some slides, so I hope this works out, okay? Fingers crossed. Okay, I gotta search. Okay, there we go. Great. Okay, so what is Candida? Candida is basically yeast on the body. It's also known as Candida albicans, and it's natural yeast that lives in and on our skin, inside our mouth, our gut, and for women in the vagina. Okay, we all have Candida in our bodies, and it's totally natural and it's okay. But it becomes a problem when it overgrows. When there's an overgrowth of Candida, it's called Candidus, and that's what I'm calling Candida. Okay, so what are some symptoms of overgrowth? Symptoms of overgrowth look like bad breath, sinus infection, joint pain, brain fog, ADD, ADHD, digestive issues, UTIs, swollen lymph nodes, food sensitivities. You get slow healing, you get cuts and you do slow healing with cuts and bruises, and food sensitivities. So let's go through them individually. Okay, so what happens when you have bad breath? Naturally everyone has morning breath or some bad breath, but if you are doing great oral hygiene, brushing your teeth 2 times a day, if you're even chewing gum to just make sure your breath is fresh, but you still have this persistent bad breath, that could be a sign of Candida. Sinus infections. This is an interesting one it could be a sign of Candida. Short-term sinus infections are mostly caused by bacteria. But if you have a chronic, long-term sinus infection, it can be due to fungal infection, which is Candida. Something like excess phlegm in your throat, just congestion right here that's just not going away. That could be a sign for Candida. Brain fog, ADD and ADHD. This is an interesting one because Candida overgrowth disrupts the microbiome in the gut, where neurotransmitters such as dopamine, serotonin, and GABA are created. So in our gut, we have good bacteria, bad bacteria. We have some fungus too, like we mentioned before. And what happens is when you have an overgrowth of Candida, it starts to it overtakes, and the good bacteria just kind of shrinks away, and the Candida just kind of grows rapid. And that starts to mess with our production of neurotransmitter. Something like serotonin, we create 90% of our serotonin levels in our body in our gut. Dopamine, people say go out and exercise because that high you feel afterwards is from dopamine. And that's 50% of dopamine is created in our gut. So that's really important. So if you're experiencing brain fog, a lack of concentration, ADD, ADHD, or even short-term memory loss, that could be a sign of Candida. Digestive issues. Things like if you're experiencing gas, diarrhea, bloating's a big one, cramps, and constipation. Recent studies find that Candida is associated with GI diseases like ulcer colitis and Crohn's disease. So if you've been diagnosed with digestive issues like SIBO or IBS and the treatment simply isn't working, you're taking rounds and rounds of antibiotics for SIBO and nothing seems to be working, and your symptoms seem to be staying in chronic, it could be a sign of Candida. Okay, Candida overgrowth in the gut. So let's talk a little bit about swollen lymph nodes. When Candida, we just mentioned Candida is everywhere. right? It's in our gut, our skin. When there's an overgrowth, especially in the gut, and this is a little bit due to when you start to have digestive issues and the lining of your intestinal walls just become more permeable, things easily come in and out, and that's kind of what we call leaky gut, and that includes pathogens, things like the bad bacteria, the bad gut flora, and this includes Candida. It can enter your bloodstream and thus like just kind of flowing all over your body. Things like swollen lymph nodes. That is a sign, that could be a sign of Candida. You know, if you're doing dry brushing, that's great. You know, when you do basic dry brushing, that's really helpful. But also if you're doing it and you still feel like your lymph nodes are swollen, you have a sore throat, and you've gone to the doctor, you know, and they say your throat looks great, everything's good, it's not a virus, it's not a bacteria, it could be simply a sign of Candida. Okay. Another thing is slow healing and slow bruising. This goes back to your autoimmune. This goes back to our immune response. You know, over time, just simply. Here, I'll go. Actually, I'm gonna go into it a little bit in the next one. But basically, over time, when you have this goes into kind of a little bit of causes of Candida, and also why we get Candida, and it goes hand in hand with stress. So I'm going to talk a little bit about why it takes a little bit longer to heal from cuts and bruises when there's signs of overgrowth of Candida. Another sign of Candida could be you have like a fast resting heart rate, but at the same time you have low blood pressure. Another sign of Candida is also food sensitivities. You know, and that again goes back to our gut, the issue of our gut. If our gut is just letting, like we like to call it at the office, a zoo. You know, if there's an overgrowth of Candida in the gut, the good and the bad, there's this misbalance between the good and the bad gut flora. It starts to create food sensitivities that we have. You may not necessarily be sensitive to tomatoes, to peas, to legumes, but because of the overgrowth of Candida in your digestive tract, you are becoming sensitive to these certain foods. We see this all the time in the office. You know, when we get new patients and they get a certain food program, you know, we like to tell them, just give us 90 days. This isn't a forever. It's just a short-term thing. Because once we can start healing your gut, you know, and whether it's bacteria or Candida in this case, once we can kill the Candida and get it to a point where it's at the normal levels in our bodies, you're going to realize the foods that you weren't able to eat the first day of your program, we start to slowly introduce back because your digestive system starts to get stronger, and those mystery food sensitivities seem to kind of disappear because your gut is getting stronger. And that could be simply from rebalancing the Candida flora in your gut system. Okay, so how do you know if you have Candida? Okay, if you have Candida, the best way to do is just go and get a blood test from your doctor. You know, they also do a skin test when they actually poke holes to see how swollen the spot is. Another thing too is Healing Arts, we do muscle testing, and we have these vials specifically for fungus, and we have 4 different types of fungus that we can test for, and all of it can be a sign of overgrowth in the body, and we find it everywhere, not just in your gut. It could be in your lymph nodes, traveling through your chest, your legs, it could be in your face, right? It's just we can just test to see where it is, and that's a really great way of finding Candida too. So if you're feeling any of these symptoms, one or a few of them, it could be a sign of Candida, and you're welcome to come to Healing Arts and we can muscle test to see that. And also go to your doctor for a blood test. Another sure sign of Candida too is, for symptoms wise, you get skin rashes. Okay, that's a really common one, skin rashes, because fungus is on our skin. And just sensitivity to skin, and just you know, when I was going through my Candida overgrowth, I would remember like any scratches that I made on my skin, they would immediately become inflamed, and it would take a long time for it to heal. That's a big sign of Candida. And another thing too is a natural one that's really the most common is when you start to see it on your nails. You know, the yellow, the growth, the fungal infection, that is a sign of overgrowth, Candida's overgrowth in your body. Okay, and if you guys have any questions, please feel free, because I am getting better at IG Live, to go ahead and type it in and I'll answer them as I go. Okay, so what are causes of Candida? This is a great one. What are causes of Candida? Okay, so some causes of Candida: diet. And diet is everything. So Candida is most commonly lives in our GI tract, which is our gastrointestinal tract. There's the good and the bad bacteria that I mentioned earlier, and fungus also lives there. So when anything we eat, you know, at the office we like to say at Healing Arts, food, it will either heal you or it will harm you. There's would Nestine cure? Okay, so sorry, Cindy, I'll get to your question. Okay, so thank you for asking it. So when you're in your intestines, you know, we like to say what you're eating will affect will either promote the good flora in your body or the bad flora in your body. And if your diet is based on a lot of refined carbohydrates, sugar is a big one that feeds Candida. A poor diet, a lot of the times over time, you're basically starting to feed more of the Candida. And Candida loves sugar. It loves sugar so much. So the more sugar you're eating, the more of that bad gut flora and the Candida starts to grow. Okay, so that is how Candida starts to overgrowth with diet. You know, another thing that also feeds Candida is alcohol. Over time, just kind of, you know, I think one of the biggest things is in the standard American diet, you know, there is a lot of refined carbohydrates. There is a lot of sugar, added sugar, in a lot of the things that we eat. And over time, simply over-consuming the added sugar, and then, you know, drinking alcohol, which actually converts into sugar too in our bodies. You know, that's just more of that feeds the Candida. So really, a poor diet will easily feed the Candida and create a Candida overgrowth in the body. Okay. Another thing that causes Candida is overuse of antibiotics and over-the-counter drugs. So, you know, when we use antibiotics, it's there to kill the bacteria that we have in bacterial infection. And the good thing about antibiotics is that it completely kills everything in our system, right? So it gives us a nice clean slate. People with SIBO tend to go on rounds of antibiotics. If you have any, you know, bacterial infection, your doctor will prescribe you antibiotics, which is great because it'll help heal you. What happens is after you take your antibiotics, the question is, how do we rebuild the good gut flora in our system? Since we've completely wiped everything clean, we have to rebuild everything back to where it needs to be. And most of the time, you know, simple use of after your round of antibiotics, you start taking in some really great probiotics, eating some fermented foods, eating clean. That will start to rebuild the good gut flora in our digestive tract. But most of the time, we actually don't really do that. We just go back to our normal diet. Something like, you know, typical, in the morning you drink your coffee with sugar. And then my old typical breakfast would be coffee and a bagel and a croissant, which is all turns into sugar. And then I would put jelly on it, which is more sugar. So, you know, going back to a standard diet after a round of antibiotics will start to feed more the bad gut flora and promote bad gut flora growth in your system. Okay, and again, overuse of it's just constant rounds. And I know, like everyone's been there when you're sick and you're not sure what's going on, and you know the doctors find bacteria in you. It's most likely you'll be receiving multiple rounds of antibiotics. It's totally okay, and it's totally, you know, there's nothing wrong with it. But what we have to do is we have to go hand in hand and make sure that the diet afterwards is not feeding and allowing and creating an environment for Candida to to grow, and not just grow but overgrowth. That's when we start getting the symptoms. Over-counter drugs pretty much does the same thing in our gut. It's hard. Things like simple things as Tums and acids, even like Tylenol, ibuprofen. The overuse of it does really start to cause disrupt our gut flora. And again, if we're not eating a healthy diet and a clean diet to help promote healthy gut flora after, it could easily create a really great environment for Candida to overgrow. Okay, so chronic stress and anxiety. Chronic stress and anxiety also causes Candida overgrowth. And again, when I mentioned earlier about the cuts and bruises, this is due to the way it affects our immune system, how chronic stress and anxiety affects our immune system. So there was actually a study done in Germany in 2006 that found that chronic stress is a primary cause in yeast infections in women. Traditional antifungal treatments only treated symptoms but not the cause, and simply reducing your stress actually helped alleviate and reduce chronic yeast infections in women. So let's talk about what stress does to the body. Okay, so when we are stressed out, our body creates a hormone called cortisol, and that actually comes from our adrenals. So where are our adrenals and what do? If you take your hands, like I like to, and I literally put them at the back and the bottom of my ribs on my back, that's where your kidneys are. And right above your kidneys, I like to say if you can imagine a little beret on top, those are your adrenals. And these, you have two. If you have two kidneys, you've got two sets of adrenals. And what happens is when we are in stressful situations, whether it's emotional or physical stress, our brain, our hypothalamus and our pituitary sends a message to our adrenals saying, we are high stress. We need to give our bodies extra energy to get through this stress. And the adrenals say, okay, I'm going to pump out cortisol to give us this extra energy. So this is a natural response in our bodies. But over time, if we're in chronic stress mode, just imagine these. If I even put my hands on the back of my back where my kidneys are, and just imagine that little beret, these little glands called the adrenals, and are just pumping and pumping and pumping cortisol every time we're stressed. It is actually, just like doing so much for us, considering the amount of size they are and how much cortisol that it's pumping through and how much stress it's helping us manage. So actually, over time, it's there to give us extra energy, and cortisol is also an anti-inflammatory in our body. But over time, after it pumps and pumps and pumps, it starts to produce less and less and less cortisol, right? So again, knowing that cortisol is there to help us go through stressful situations, and it is also an anti-inflammatory hormone. When we start to get stressed out and there's less cortisol, our inflammation starts to run rampant, and it's not really treated naturally through our body's natural system. So over time, chronic stress and anxiety decreases our immune response. And so therefore, a symptom of Candida is slow healing from bruises and cuts, because we have a slower response time from our immune system, and that comes from chronic stress and anxiety. Okay. Another cause of Candida is chemical exposure. Okay, so chemical exposure, things like chlorine and fluoride and plastic, actually aid in the overgrowth of Candida. Fluoride and chlorine can be found in our drinking waters. Chlorine's in bleach. Fluoride's also found in our toothpaste. What it actually does is it kills bacteria. For the good of, chlorine is great. That's what bleach is, and it kills bacteria, right? But if you're ingesting it, it's actually killing the bacteria in our gut too. Again, this is similar to our how antibiotics work. Either it's killing everything. It's not discerning between good bacteria and bad bacteria. So when we're consuming chloride, not knowingly in our water system, it's killing the bacteria. And also the fluoride's killing the bacteria. So as it kills the good and the bad bacteria, what's left behind is Candida. And so that's when the Candida, which is like, we love to say Candida is opportunistic. If there's a place for it to grow, it will grow. If there's an opportunity for it to grow, it will grow. So, the more room there is for the Candida, and you're like eating this diet that feeds it, it's gonna naturally thrive. Okay? Plastic is also the same. Plastic works a little bit differently. And plastic is known as an endocrine disruptor, meaning it really disrupts our hormone function. And when our hormones are totally out of whack, again, cortisol is a form of hormone. And if it's completely not running the way it is in our bodies, doing its job, similarly, it's lowering our immune response, then again, there gives it an opportunity for the Candida to grow. So those are some of the main causes of Candida. If I were to categorize like which one is the most, I would really say diet. Because diet is something that we absolutely have control over. And this is something that's really easy for us to, really make sure that we're putting things in to help balance our gut flora, to help heal our bodies. In terms of chronic stress, there's great meditations to help with stress. Something like I love to do breathing exercises, meditations, whether it's visual, audio, or even like making sure you take some walks to just kind of like let your energy out and be present and focus on something besides your stress. All of these things are easy ways to prevent and control Candida growth in our bodies. Okay, and also making sure that you are not allowing chemical exposure. When it comes to chlorine and fluoride, something really simple is like with the fluoride, just double check your toothpaste. Make sure it's fluoride free. Just imagine how many, we're brushing our teeth maybe two or three times a day, and that's leading to fluoride exposure into our systems. Check your toothpaste. Make sure it's chloride free. When it comes to chlorine in our water, the best way to fix that is to actually get a water filter. Get a water filter and use a water filter and have your water be filtered so it becomes chlorine free, so that you're not ingesting the chlorine that will kill the good and the bad bacteria and let the overgrowth of Candida happen. Okay, so the second part is, how can we make sure we are doing everything we can to avoid plastic exposure? Okay, that's a good question. Something really as simple as just think of the plastic that is in contact with our food and into our mouths. So plastic straws, plastic utensils, a really big culprit, but I always forget for myself, is coffee lids, right? They're made out of plastic and it's super hot. So by the time that hot liquid touches the plastic lid and it enters my mouth, it already is releasing the plastic chemical into my body. Another thing is plastic water bottles, right? Water that's in plastic. You don't know how long it's been. The plastic is leaching easily into the water that you're about to drink. So if you're drinking out of plastic water bottles, it might be a good idea to start switching into something like glass or stainless steel drinking water. Another way of plastic exposure is saran wrap. Every time you wrap our foods in saran wrap, the food is touching the plastic, and the plastic is entering our food. Okay, if you can, please try to use something else instead of wrapping your food with plastic. Even aluminum foil can be damaging because it's considered a heavy metal. So what I like to use parchment paper. You can get the paper that is coated with beeswax to actually wrap things. The silicone pouches are really great. Another form of plastic exposure is Tupperware, right? Tupperware, especially when you throw it into the microwave. Once you heat plastic, you're releasing chemicals. You're releasing the plastic chemicals into your food. So if you are going to use the microwave, please put the food in a bowl, a glass bowl, a ceramic bowl before you heat it. Even with the saran wrap, make sure that the food isn't, when you're putting things into the microwave, that you're saran wrapping it and releasing and heating up the chemical of plastic and releasing it into your food. Okay, so let's talk about some great things that can naturally kill and reduce Candida. Some foods, okay? Definitely, one of the question was, something, I forgot, Cindy asked, would this alone kill Candida, cure systemic Candida? And the question is, any round of treatment and drugs you take for Candida will immediately kill it, but Candida loves, and it is resilient, and it loves to thrive in like the kookiest places in our bodies. So simply taking a drug will help, but the thing is, we have to catch the fact that it doesn't grow back, because Candida is a natural yeast that lives in our body. And if it's balanced, it doesn't cause any issues. But when it becomes overgrowth, that misalignment and that disruption in the balance is what causes all these symptoms of brain fog, achy joints, of bloating, fatigue, diarrhea, all of that. So yes, the drug will kill it immediately, and it will help. But what we want to focus on too after you do a treatment is how do we maintain that healthy gut flora so it doesn't easily overgrow, right? Because again, if you're constantly relying on these drugs to kill your bad gut flora, it's almost like a perpetual cycle, and we have to stop the cycle somehow, right? And we have to catch it so that it doesn't continue. And it's simple, and it's something as simple as making sure we're eating the right foods, and we're fueling the good gut flora in our systems and not feeding the Candida to overgrow. Okay, so what are some good foods for Candida? Okay, garlic and onions. Garlic and onions are great. Okay, they're high in alinicin, which has antifungal properties. So one of the best ways to consume garlic is raw, and the best thing is to chop it up and mince it up and let it sit for 10 minutes. That's when all of the properties are released, and then to consume it after 10 minutes. Onions are the same. Onions are great and high in antifungal properties. Ginger, ginger is also another great one. Eating minced ginger helps fight Candida. There are antifungal compounds in ginger called gingerol and sagelol. So I'm so bad at pronouncing all of these terms. It's always been that way, so please bear with me. And there also ginger also has antifungal compounds and anti-inflammatory agents that actually stop the growth of Candida. Again, Candida is natural, but because of our just highly processed and highly refined and high sugar diets, we naturally and unknowingly are feeding Candida. So introducing minced ginger, minced garlic, and onions are natural ways to kill and prevent the growth of Candida. Okay, another great thing that will help fight Candida is curcumin. Curcumin is the active anti-inflammatory agent in turmeric. So in test tube situations, they have found that curcumin has shown to actually kill Candida yeast. So again, this is like in test tube situations, but we know that it's also really anti-inflammatory and great for our system. So they've also studies have found that curcumin is actually more effective than antifungal drugs, prescription drugs. And when they prescribed curcumin to HIV patients who are suffering from oral thrust, which is a sign of Candida, it actually killed the bacteria better than the over-the-counter prescription medications that they were given. That's quite interesting, right? Okay, another great thing that we love in the office is raw apple cider vinegar. So it's almost like when you drink raw apple cider vinegar, it just really makes it a hostile environment for Candida to grow in your system. So consuming something as simple as 1 tablespoon of raw apple cider daily will actually prevent and inhibit Candida growth in the system. At the office, we have this great apple cider tincture tea that Dr. Armistead created, and something as simple as a tablespoon of apple cider vinegar, half a squeeze of lime, add with a little bit of 1/4 teaspoon of baking soda, add a little bit warm water with a pinch of turmeric. We put a little cayenne pepper and black pepper, and then you go ahead and just drink that the first thing in the morning. It sets, on an empty stomach, it really sets a really good, it kind of like starts the day for your gut, right? It starts a really nice environment for your gut, and it naturally kills the candida. Another thing I love about apple cider vinegar is that it's really great at, it's really, really good at regulating blood sugar levels, and it also helps with weight loss. Another good thing, way to kill candida naturally is eating kale and cruciferous vegetables. It's really similar to, the way apple cider vinegar works. Vegetables and non-other starchy vegetables nourish the beneficial gut flora and the gut bacteria in the digestive tract, so that it actually prevents an overgrowth of candida. So again, it's cruciferous vegetables and non-starchy vegetables. Okay, cutting and limiting sugar. Okay, if you were to ever Google candida, candida diet, the first thing you'd probably find that they tell you to cut all sugar from your diet, and it's because candida loves sugar. It's almost like if apple cider was on one end saying, if apple cider vinegar was on one end saying like it is a very hostile environment for candida growth, then sugar would be on the other end saying it's extremely inviting for candida to grow in your in your intestinal tract. So if you can limit and cut sugar, specifically refined sugar, that's a really, really good start. White refined sugar has no nutritional value whatsoever, and it literally is just for pure taste. So if you do have a sweet tooth and you're finding it really hard to cut sugar, what I like to recommend, and what we like to recommend at Healing Arts, is something as using coconut sugar. It is a sweetener, but because it's not as processed, you get the benefits of the healthy minerals and the vitamins that come with coconut sugar. Another thing, and it's also less processed, so that when you eat and you consume coconut sugar, it actually stays in your body longer, and it takes your body longer to break it down. Therefore, it doesn't shoot your blood sugar levels as high and fast as refined sugar. Another sweetener we like is maple syrup, real maple syrup. Another one that we love is stevia. Stevia happens to have a lot of medicinal properties. And another one too, cane sugar. Sometimes people are okay with cane sugar, but you kind of have to watch a little bit of your consumption with that one. Okay, so once you cut and limit sugar from your diet, it actually stops feeding the candida. Okay, and added sugar is in almost everything. It's in ketchup that we eat. It's in the yogurt that you're eating. It could be in the yogurt that you're eating. Any of the condiments that you have, added sugar like ketchup, mustard, salad dressings. Another way of unknowingly eating added sugar is sometimes even your fruit juices. It says 100% fruit juice, but if you read the label, there might be added sugar in it. There's something eating as, if you like jam, there are 100% sugar-free jams, but you kind of have to make sure you're reading the labels to make sure that there's not added sugar in that. Another really interesting added sugar thing, I always I find this so fascinating. Like in Ireland, they banned Subway bread because they don't even consider the Subway bread in Ireland doesn't even consider the bread in Subway bread anymore because there's so much added sugar. So just to give you a comparison of added sugar in that bread at Subway, a natural baguette that you get, like a nice natural baguette, has only 3 grams of sugar in it. And the Subway loaf that's 1 foot has 6 grams of sugar. That's a lot of sugar for a little piece of bread. And that's due to added sugar. So make sure, if you're slowly cutting out sugar, and if it's just something as changing your sweetener in the morning, making sure you're not eating any cakes, cookies, cupcakes, right? That's a great way to start. And once you start getting into as you start to get more comfortable with cutting the sugar, start looking at the labels and nutritional facts. all nutritional facts labels now have to, by FDA ruling, they have to add how much added sugar is in per serving. So please check how much sugar you're consuming. Okay, so another great way to kill and reduce Candida is cooking with coconut and olive oil. Coconut oil has really great antifungal properties, and olive oil is the same. So if you're cooking with vegetable oil or canola oil, I suggest you switch to something like coconut or olive oil, which actually has antifungal properties and will kill and reduce the Candida growth in your system. And powdered cow tea, this little tree bark is pretty amazing from South America. It has a lot of antibacterial, anti-inflammatory, and antifungal properties. So as simply as drinking 1 cup of powdered cow tea every day will help reduce and kill Candida in the system. Okay, so now one thing that I want to talk about, after what we went through, what Candida is, so what are symptoms of Candida, how do we have Candida in the body, how does it overgrowth, from chronic stress and diet and overuse of medication. Now you're starting to eat healthy, you're taking finding ways to reduce Candida. And now I want to so what's going to happen afterwards? Sometimes you will feel worse before you feel better, okay? And that's called the Candida die-off reaction. And it's the Herxheimer reaction. Okay, so when you start killing Candida in the system, you can experience Candida die-off reaction. And some symptoms are fever, chills, muscle fatigue, weakness, inflammation, dry mouth. You may find that you're sweating more. Again, swollen lymph nodes, gas, bloating, constipation, diarrhea, fatigue, or even skin rashes. So this list may seem very similar to the symptoms of Candida. And I want to explain why this happens. So when anything, when things die in your system, right? Something as Candida. If there's an overgrowth of Candida and we start to kill it, right? What happens is, as the Candida dies, it actually releases its toxins into the bloodstream, and it's called the die-off reaction, die-off of Candida, and it releases these toxins, and it for a short while, it kind of releases in our system, and our body's natural immune system starts to kick in, and it goes into hyper overdrive. And as it goes into hyper overdrive, we start to experience a little bit of the fever and the chills, and also the release of toxins. Starts to it turns on, and it has to get filtered through our kidneys and our liver. So it's just a lot of things happening all at once, and the body is just doing its best to release. So if you think about it, sweating is a natural detox symptom, right? Not a symptom, natural detox mechanism for our bodies. Sweating is a great way. That's why we go to saunas. It really releases a lot of toxins. So you may experience some sweating, which is natural because it's a detox reaction. Swollen lymph nodes are similar, right? Your lymph nodes are there because it helps your immune system. So if you can just imagine this immediate release of toxins to the bodies, what is it going to do to your lymph nodes? It might get a little swollen because it's not used to the rush of toxins that we're trying to kill off and release them from the body. Dry mouth, inflammation, fatigue. Again, this is also even skin rashes. Getting a little bit of a rash in the skin. Your skin is a detox organ too. So these bursts of rashes is a way of the body detoxing. So you may feel a little bit of this once you start your Candida program, right? Your Candida, anti-Candida diet, anti-Candida protocol, you may start to feel some of these symptoms, and they may feel like it's getting worse before it feels better, but it is a sign that you are healing. Okay, we also like to call this a healing crisis, or a medical term is also the immune cascade. Okay, it doesn't sound fun, but you are getting better. One thing that's really great at Healing Arts is that we like to say we want you to feel better before you feel worse, especially when you're in your healing process. So coming in with muscle testing, we can make sure that your body is detoxing properly in a rate that you are not feeling worse as you are trying to get better. So that's one thing that I really love about muscle testing. So that is a quick workshop on Candida. What it is, what are some symptoms, how it's caused in the body, some really great foods that is that's really, really accessible and easy to get that will start healing and reducing Candida in the body, and also like what you might experience as you start killing the Candida in the body. So if you guys have any questions, feel free to DM us at healingarts.nyc, healing.arts.nyc. I was going to say healingarts@nyc. Sorry about that. Feel free to email us, DM us, ask us. If you think that you are experiencing Candida, come in and schedule a time for an appointment, and we can actually see what's going on, and we can give you a really great tailored food program, your own specific and your tailored Candida diet program, along with some really great supplements to help detox, and again, detoxing in a way that you aren't experiencing these die-off reactions. So thank you for your time today, and if anyone has any questions, feel free to type them in the comments or go ahead and email us too, okay? All right, thanks guys. Have a good day. Take care.